So I am from Washington, D.C. I was raised overseas. I lived in New Delhi and in Cairo growing up, and then came back to the States for the rest of high school and college. I did my general surgery training at Penn. I met my husband there. He's a cardiac surgeon over at CHOP. We have 2 little kids, and we love playing with them and spending time as a family. When I was graduating from residency, I was looking for a practice and a location to practice where I could really reach a community. And when I came out here to interview, that was the sense that I got. This was a hospital and a surgical practice that was interested in treating patients with high quality standards out in the community and keeping the care here. So as someone who trained at a coronary care center, it was important to me to be able to use those skills out in a community with potentially less access to that care. General surgery is tricky because in its origins, it was truly treating the body head to toe. Now it's primarily treating the abdomen. So hernias, gallbladders, appendices, bowel resections, but also lumps and bumps all over the body. And I'm sure there's some other things mixed in there too, but that's probably the best description. My approach is to get to know the patient from start to finish. I don't like to trust the medical record for a whole lot. I like to ask patients lots of questions and really get to know what brought them in, what's bothering them the most about the condition that they're seeking treatment for, and so we can work together to formulate a plan and potentially work with their other physicians if they have other medical conditions to make sure that we deliver that care safely. I would say I'm fairly old school. I love laparoscopy, I love robotics. I've been trained in those things in residency and in my training and plan to use them. But I think one thing that I can bring to the group that potentially is not as widely done right now is the care of really complex abdominal problems. So people who've had multiple prior abdominal surgeries, maybe who have fistulas or really complex hernias. I'd like to bring what I've learned and bring a multidisciplinary approach to those patients. I think that finding a team that really cares for you as a whole person, that gets to know your family, your support system, and that you feel like can time the surgery for when it's best for your life. Sometimes that means taking the summer off from healthcare, and that's okay, or taking the winter off so you can go to your daughter's wedding. People need to know that that's okay, and I would love to be able to help people figure out how to time it in a place that works for them, and I think sometimes that's overlooked. We don't always have to do things right now, but working together with the patient, with their other providers to find the best time for them and their family can sometimes help alleviate some of that anxiety around it. Then we can make a plan and really kind of get in the right mindset.